रोदबलभ्रंश घोरबानिलमुडताहम् आलस्यापक्तिनिष्ठिव मलसंगारुचिक्लमाः. This is the description which is being told in the context of a Samanya Amalakshana. From the past several videos, we are discussing about the individual Lakshana and their interpretation. In today's video, we are going to discuss about the Nishthiva and Ama. The term Nishthiva refers to the secretions which is coming in the respiratory passages. So, what is the relation between the Nishtiva and Ama? Whenever if you think about the Ama, specifically that is being observed in the alimentary canal. Later that will be observed in the intravascular compartment, then to interstitial compartment, later in the intracellular compartment, depending upon the Jataragni Mandya, Dhatwagni Mandya and Bhutagni Mandya. What is the relation between this particular Nishtiva, which is totally a symptom related to respiratory passages, and the Ama, which is initially observed in the symptoms specifically seen in the alimentary canal? We can able to link these two concepts with fine tuning the informations. So when you think about the presence of Ama, that means the person will be having the intake of the, the food, that abnormal type of the food, maybe in the form of either Adhyashana, or maybe in the form of either Vishamashana, or maybe in the form of either Atyashana, or maybe in the form of either Viruddhashana, or maybe in the form of either Samashana. When you think about it, see, more than the, if you look into the surroundings, nearly around 95% of the cases, the person will be having the Ama manifestation because of the abnormal diet pattern only. Based on that, so what actually happens is, there may be a possibility of these food remnants that may be present in the mouth. Some of them that may be present in the stomach normally up to a period of 2 hours. This may be the abnormal, the digested food remnants may be present in the small intestine for a period of almost 6 hours. And in the large intestine, these macromolecules as such that may remain for a period of 24 to 48 hours. In the mouth, because of the poor oral hygiene, the person will be having the macromolecules presence in the mouth itself, around the teeth or gums as such, which may be leading to the, the dental caries, etc. Or which may lead to halitosis, what we can say, the bad breath which is coming through the mouth. When this is considered, naturally, so that will be responsible for the, the sympathetic stimulation or parasympathetic nerve stimulation. When there is the autonomous nervous stimulation, which may leading to the increased, increased secretions which may happen in the mouth itself. So that means there may be a possibility of the either inflammation that can happen in the mouth, or the person may have the tonsils enlargement, or the person may have these particular entry of these secretions that can happen even into the lower respiratory passages, which is considered to be responsible for the irritation to happen in the respiratory passages. Thereby the person may have the secretions that may happen in the respiratory passages. There are certain occasions where these particular the substances, that is the food remnants, which may be responsible for the inflammation to happen, therein the person may have these particular the inflammatory markers to enter into the respiratory passages. Either it may enter into the upper respiratory passage, maybe in the form of nasal regurgitation may happen, or this particular inflammatory marker that may enter into the lower respiratory passages, resulting in the inflammation to happen in the lower respiratory passages. Thereby, the person may have the secretions increased in the respiratory passages. The third possibility, wherein the because of the adhyasana, etc., there may be a possibility of a aspiration of the contents of the alimentary canal to enter into the respiratory passages. Thereby, the person may have inflammation in the respiratory system itself, which is again a reason for the what do you say that the uh, secretions or the to happen in the respiratory passages. That's how the ama may lead to inflammation or infection to happen in the alimentary canal or the in the mouth itself. Thereby, the person will be having the secretions to happen in the respiratory passage. Thereby, the person may have Nishthiva to happen as such. This is the overall understanding of Nishthiva and Ama. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners or true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.